Most people have no idea that pancreatic cancer is one of the deadliest cancers known today, quietly surpassing breast and prostate cancer in mortality rates across many countries. Yet it continues to fly under the radar, drawing little public attention despite alarming increases in incidence. Imagine a disease that claims more lives each year than almost any other cancer, yet remains a whisper in everyday conversations about health. In the United States alone, over 65,000 people die annually from pancreatic cancer. Globally, it accounts for more than 432,000 new cases and over 430,000 deaths every year. Those statistics become even more chilling when you realize that fewer than 1 in 8 patients survive 5 years beyond diagnosis, a stark reminder of how lethal this cancer can be when left unchecked. What makes it so treacherous is its talent for hiding deep in the abdomen, behind the protective shield of other organs, so its early warning signs are subtle enough to blend in with run-of-the-mill digestive complaints or simple fatigue. Yet research now reveals that these early signals can appear if you know what to look for. 3 to 6 months before a formal diagnosis is made, offering a precious window of opportunity in a disease that is often detected only when it has already spread. Your pancreas is a small tapered organ nestled behind the stomach, cradled by the curve of the duodenum on one side and reaching toward the spleen on the other. Despite its modest size, it performs 2 vital functions. Exocrine cells produce digestive enzymes that help break down the fats, proteins, and sugars in the foods you eat, while endocrine cells secrete hormones like insulin and glucagon to regulate your blood sugar. When a tumor begins to grow in any part of this hidden gland, it can quietly impair one or both of these functions, disrupting your digestion, your metabolism, and ultimately your entire sense of well-being. Because it is tucked so far back in your body, early tumors rarely cause a noticeable mass you can feel with your fingertips. They also do not typically trigger the kind of localized pain that would immediately send you racing to an emergency department. By the time more obvious signs, like jaundice or severe upper abdominal pain, emerge, the cancer has often already advanced to a point where curative surgery is no longer possible, and treatment becomes focused on extending life and easing symptoms rather than achieving a cure. That's why learning to recognize the silent signals your body sends can be so critical. If you or someone you care about experiences any of the following 8 symptoms, especially in combination, it could provide the clue needed to seek testing early, when the odds of successful intervention are highest. Even better, if you catch pancreatic cancer before it has spread beyond the pancreas or the immediate surrounding tissue, the 5-year survival rate can improve significantly, sometimes rising to 25–30% in well-selected surgical candidates compared to the dismal 5–12% overall. Let's explore these warning signs, explain why they arise, and emphasize why no single symptom should be dismissed out of hand. First, digestive disturbances are among the most common yet frequently overlooked early indicators. As tumors grow, they interfere with the pancreas's ability to produce or release key digestive enzymes. Without ample lipase to break down fats, amylase to digest carbohydrates, and proteases to process proteins, food remains partially undigested as it moves through your upper gastrointestinal tract. You may notice persistent bloating shortly after meals, a deep sense of fullness that no amount of skipping meals seems to alleviate. Meals that once left you with a comfortable glow of satisfaction can suddenly become uncomfortable, accompanied by frequent belching, nausea, or even the occasional bout of vomiting. Over weeks or months, you might find your appetite waning. Your body, starved of properly digested nutrients, literally cannot muster the energy to crave food. That progressive appetite loss often leads to unintentional weight loss, sometimes a dramatic 10, 20, or even 30 pounds in a matter of months, with clothes that used to fit comfortably suddenly hanging loose. Beyond changes in what you eat, you may observe alterations in how you eliminate. Greasy, pale stools that float or stick to the sides of the bowl, foul-smelling and resistant to flushing, indicate fat malabsorption known as steatorrhea. When your stool takes on this appearance, it's a signal that the pancreas is failing to break down enough dietary fat, a red flag that merits prompt medical evaluation. Second, profound fatigue and persistent physical weakness often accompany those digestive woes. Unlike the tiredness that follows a late night or a long day at work, cancer-related fatigue is unrelenting. It is not relieved by sleep. Instead, it settles deep into your bones and muscles, making even basic activities, climbing a flight of stairs, carrying groceries, taking a brief walk, feel like monumental tasks. Inside your body, cancer cells are metabolically voracious. They compete with healthy tissues for glucose and amino acids, diverting the nutrients meant to sustain you into their own rapid growth. As a result, you feel drained, your muscles lose mass in a process called cachexia, and you may notice that arms and legs feel notably thinner, weaker, or more fatigued than before. This decline often brings emotional strain as well: anxiety, irritability, difficulty concentrating, or depression, only compounding the sense of helpless exhaustion. Because fatigue is such a common complaint, it is easily misattributed to stress, depression, or simple overwork. But when it persists for weeks on end, deepens rather than improves with rest, and occurs alongside unexplained weight loss or digestive issues, it should ring alarm bells for both patients and providers. Third, intermittent fever and chills can be part of the body's inflammatory response to a pancreatic tumor, yet they too are commonly dismissed as a low-grade infection or the lingering effects of a cold. When your pancreas becomes irritated by a growing tumor, it summons immune cells that release cytokines, IL-6, tumor necrosis factor, and others, that raise your hypothalamus's temperature set point. This produces fever, which may wax and wane over days or even weeks. You might find yourself experiencing shivers or night sweats that drench your pajamas and sheets, then feeling flushed and feverish just hours later. Unlike the predictable progression of a flu, these temperature fluctuations tend to persist or recur, and they rarely respond fully to over-the-counter fever reducers. When you pair fever with digestive changes, fatigue, or one of the other warning signs, it's another clue pointing to a process more serious than a simple viral infection. Fourth, pancreatic cancer notoriously creates a hypercoagulable state, increasing your risk for blood clots in ways few people realize. Cancers in general can tip the scales of your clotting system toward excessive coagulation, but pancreatic tumors are among the most potent offenders. They release tissue factor and other procoagulant substances into the bloodstream, prematurely activating platelets and clotting factors. The result can be deep vein thrombosis, DVT, in the legs, manifesting as sudden unexplained swelling, warmth, tenderness, and a reddish or bluish discoloration. A clot here is dangerous enough. If a fragment breaks off and travels to your lungs, it can cause a pulmonary embolism, leading to sudden shortness of breath, chest pain that worsens with deep breaths, rapid heart rate, and lightheadedness. Such an event is life-threatening and demands immediate attention. If you experience signs of DVT or pulmonary embolism, doctors will often search for an underlying cause, and in many cases, that leads them to uncover otherwise hidden malignancies, especially in the pancreas. Fifth, obstruction of the bile duct, which passes through the head of the pancreas, can cause your gallbladder and liver to swell in mechanisms known as Courvoisier's sign. Bile produced by the liver normally drains through the bile duct into the small intestine. When a tumor presses on or invades that duct, bile backs up into both the intrahepatic ducts and the gallbladder. Over time, the gallbladder may grow to the size of a small pear and become palpable beneath the right rib cage, sometimes causing mild right upper quadrant tenderness. Meanwhile, the liver, filled with backed-up bile, may enlarge and press against the lower ribs, creating discomfort or fullness. These physical findings, detectable by a trained physician via palpation and ultrasound, are red flags for biliary obstruction and often represent one of the earliest signs that demand imaging studies to check for a mass in the pancreas. Sixth, persistent gas and bloating can signal that the pancreas is no longer secreting enough enzymes to aid digestion. Without adequate lipase, amylase, and proteases, fats, sugars, and proteins linger in the digestive tract, fermenting and producing gas. You may feel distended in your abdomen even when you haven't eaten much, or you might experience early satiety, becoming full after just a few bites. Unlike occasional indigestion, this bloating does not reliably improve with antacids, simethicone, or dietary tweaks. It often intensifies after meals and can persist into the evening, leaving you uncomfortable and lethargic. Seventh, a dull, persistent pain in the upper abdomen or the middle of your back, often described as a band-like ache, can herald a growing pancreatic tumor pressing on nearby nerves and organs. This pain is distinct from the sharp, localized gastric cramps or muscle strains most of us have experienced. It typically worsens when you lie flat or after large meals, and over-the-counter pain relievers provide little relief. The pattern of a chronic ache radiating from your mid-back to your abdomen is a classic sign that ought to prompt further evaluation with CT or MRI scans. Eighth, one of the most dramatic yet easily overlooked signs is a change in urine color. When pancreatic tumors block the common bile duct, bilirubin, a yellow pigment produced by red blood cell breakdown, cannot drain properly into the intestine and instead spills into your bloodstream. Your kidneys do their best to filter out this excess bilirubin, but in doing so they leave behind a telltale clue: dark, tea-colored or cola-colored urine, even when you have remained well hydrated. Many people dismiss such discoloration as dehydration or the effect of certain foods or medications, but if it persists for more than a day or two despite adequate fluid intake, it warrants immediate medical attention. Early recognition of this sign, often preceding visible yellowing of the skin or eyes, can spur timely testing and, if cancer is found, vastly improve treatment options. Taken individually, each of these 8 symptoms, digestive disturbances, profound fatigue, fever and chills, unexplained blood clots, gallbladder or liver enlargement, persistent bloating, chronic upper abdominal or back pain, and dark urine, might be dismissed as minor complaints or attributed to more common ailments. But when 2 or 3 of them occur together, especially in someone over the age of 50, or with risk factors like smoking, chronic pancreatitis, or a family history of the disease, they form a pattern that screams for comprehensive evaluation. Recent studies suggest that recognizing just 3 of these warning signs as part of a concerted diagnostic effort can increase early detection rates by up to 70%, a figure that could translate into thousands more lives saved each year. Because pancreatic cancer is so aggressive and often asymptomatic until it has spread, being your own health advocate becomes crucial. If you experience persistent digestive changes, unintended weight loss, nagging back pain or dark urine that doesn't improve, insist on further testing, an abdominal ultrasound or CT scan, blood tests for liver function and tumor markers, such as CA19-9, and possibly an endoscopic ultrasound or MRI for finer imaging. Early-stage tumors can sometimes be surgically removed with procedures like the Whipple operation or distal pancreatectomy, offering the only real chance at cure. Even when surgery isn't possible, earlier detection allows for more effective chemotherapy, radiation, or enrollment in clinical trials. The most important takeaway is that knowledge truly is power. Pancreatic cancer may be a silent killer, but it doesn't have to remain undetected. If you see these 8 warning signs in yourself or someone you love, don't wait for them to resolve on their own. Talk to your doctor, push for imaging, and consider seeking a specialist's opinion. Spread the word, share this information far and wide. If you found these insights helpful, please share this video, subscribe for more vital health updates, and turn on notifications so you never miss a life-saving tip. Your awareness today could mean someone's survival tomorrow. Remember, every day counts. The sooner pancreatic cancer is spotted, the greater the chance that patients can fight back successfully and regain hope for a healthier future.